You're listening to Well Within 10, a bite-sized approach to working on your wellness. 10 minutes of wellness thought leadership from experts across the country, hosted by me, Stevi Carr. Today we are chatting with Dr. Aparna Shah, urogynecologist specializing in female pelvic medicine and reconstructive surgery. We're going to talk all things pelvic floor disorders. So welcome, Dr. Aparna Shah. Thank you so much for being here.
Thank you. Thanks for having me.
So pelvic floor disorders, tell me a bit about what we're going to be discussing today.
Pelvic floor disorders refer to sort of a group of disorders or problems people have with their pelvic floor. And usually the question that follows that is, what is the pelvic floor? So the pelvic floor is basically just a group of muscles and ligaments and connective tissues and bones, kind of that form a bowl at the base of the pelvis and support the organs in the pelvis. And so when anything goes wrong with any of those structures, the result is a variety of pelvic floor disorders. And so that's what we're going to be focusing on today.
Oh my gosh, well, so relevant, especially for women of today, so many working mothers and people just as we go through the aging process. I'm excited to dive in. This episode is powered by the Christ Hospital. For more than 130 years, the Christ Hospital has been dedicated to providing the best, most compassionate care for our community. By continually reimagining what healthcare can be, Christ has been more than just a hospital in our region. Today, they're an extensive network of 6,500 employees, 1,200 physicians, and 600 volunteers, serving patients in more than 100 locations across greater Cincinnati. Learn more at thechristhospital.com. So let's dive into the conversation. What exactly is a urogynecologist, and how does that kind of differ from traditional gynecologists that we know about?
While we do have background in general obstetrics and gynecology, what most of us urogynecologists, and me in particular, what I focus on is really pelvic floor disorders. That we kind of talked about a little bit earlier. I don't do any obstetrics anymore, and I'll do a little bit of gynecology. So because there's some overlap, so if someone comes in with an issue, but it's not primarily what patients are being referred to me for, and often the person sending the patient to me is a general gynecologist. So I tend to focus more on, issues that are really specifically pelvic floor disorders and not as much of sort of the routine GYN health maintenance and, ovarian cysts and bleeding. That would be more in the general gynecologist territory. So we really are kind of experts of the pelvic floor.
That's amazing. And I know speaking, to being able to have a specialist that you can connect with and understanding that we know that 1 in 3 women have things like adult incontinence, and 1 in 9, I think maybe 1 in 8 now are doing anything about it. So I'd love to dive in and just start to talk a little bit about what are some of the types of things that you probably see most frequently? What are people dealing with these days?
Yeah, yeah. And I love that you mentioned how common these are. And I love
Mm,
that you mentioned how few women actually seek help
yes.
for this, because I sort of think of one of my biggest jobs as sort of educating women about pelvic floor disorders so that they'll understand that they're not alone and that they'll understand that it's okay to ask for help and to talk to your general doctor or your gynecologist, or to even just seek us out directly, so that we can help with these disorders. Kind of the most common pelvic floor disorders, I would say urinary incontinence is probably the single most common. The other really common thing that we deal with is pelvic organ prolapse, which is when any of the pelvic structures or pelvic organs herniate into the vaginal wall and sometimes out past the vaginal opening. Other really common pelvic floor disorders that we deal with are, involuntary leakage of stool. We deal with pelvic floor related pain syndromes. We deal with people who have trouble emptying their bladder, recurrent bladder infections. So I would say those are probably the most common, but I would say, 90% of my day is really spent dealing with a variety of types of urinary incontinence and then that pelvic organ prolapse or those vaginal hernias.
And it's so wild to me, the compensating behaviors that we as women endure, that we, as we dive into this, we talk about, I meet so many women. I did not give birth, adoptive mother, but so many women who have had birth, years down the road have said, I've dealt with this for a really long time, or people who are athletes,
Right.
who, didn't really understand how to help, manage their bodies. And so I think that I would love to just chat a little bit about, what are those risk factors associated with AI, and how are we able to kind of help people understand that, what would the pathway look like to working with you? Because
Yeah.
you have to go, do you have to be referred to you, or can they just make an appointment with you?
Yeah, I mean, I think that varies with insurances. So
Okay.
we definitely have plenty of patients who just, find us on social media or hear from a friend or a sister, and then we get a lot of referrals, I would say, primarily from primary care and gynecology, but also a fair number of referrals from like urologists, GI doctors, and colorectal doctors, just because there is a fair amount of
Yeah.
overlap, and there are some sort of urogynecologic disorders that tend to be common in women with other kind of bowel issues. So um, those are kind of I would say, the types of physicians that we most commonly share patients with.
Okay.
As far as risk factors for pelvic organ prolapse, so it's very, very what we like to call in medicine multifactorial, meaning there isn't a single risk factor that, like, if you have this risk factor, you will get prolapse.
Okay.
Like many conditions, it's more that there are certain things that might predispose you to them. And those things are, so genetics is probably a big one. We don't fully understand how genetics impacts the pelvic floor, but we certainly know that, if your mom and all your sisters have a pelvic floor disorder, you're probably more likely to have a pelvic floor disorder than someone who's got no family history. Certainly getting older and menopause are risk factors, but I think it's really important to understand that pelvic floor disorders can happen across the age spectrum, and pregnancy and childbirth are really major risk factors for pelvic floor disorders, which is why we actually see a fair amount of pelvic floor disorders even in our really younger cohort of women, like 20s, 30s, 40s. This isn't something that only affects people in their 60s, 70s, 80s. This really does affect women across the lifespan. Other things, obesity may contribute,
Mhm.
lifestyle factors, so smoking may contribute. People with connective tissue disorders may be more likely to get prolapse. People who chronically lift or strain, those can all contribute to development of pelvic floor disorders.
And as we talk about treatment options, can you just briefly touch on a few of the different approaches that you have?
Yeah. So, when it comes to urinary incontinence, really about 95% of women who come into my office with urinary incontinence have one of two types of leakage. So, those two types of leakage are stress urinary incontinence, which is the type of incontinence that you were referring to in athletes. So when you jump, when you lift, when you cough, when you sneeze, and that type of leakage is the most common type of leakage in our younger cohort of women. Of course, happens across the age span, but in our 20s, 30s, 40s, we see lots of that stress urinary incontinence. And that type of leakage has to do with weakened sort of supports underneath the bladder and the tube you pee through. And so the treatments are all really aimed at correcting that support. So for women who choose that they don't want to live with it, and it's certainly okay to live with it if it's not bothersome, but we will often recommend pelvic floor physical therapy, so strengthening the pelvic floor muscles. And if we're going to recommend that, I love to recommend a great physical therapist, because women always say, I'll go do my Kegels on my own. But, really, there are people who are trained to teach women to do these correctly and
Sure.
consistently. So
Yeah.
pelvic floor physical therapy is a great option. The other options are support devices that can be placed in the vagina to actually give you physical support. And then there's a host of like procedures that can be done for that type of urinary incontinence. Um, Urgency incontinence is the other really common type of incontinence we see, and again, can happen across the lifespan, but tends to get more common as we get older. And as women get older, we see a lot of women who have both the urgency and the stress incontinence. The urgency is most commonly due to sort of nerve issues with the bladder.
Okay.
And so the treatments are very different than for stress incontinence because the causes are very different. And the treatments are really aimed at kind of quieting down the bladder nerves and or muscles. So we use a variety of medications. If medications don't work, there's more advanced procedures that are very simple, outpatient or office-based. So we have nerve stimulation procedures, we have Botox. And then with urgency incontinence, it's also really important to control sort of lifestyle factors. So people who are really drinking excessive fluid or soda or caffeine, those are all bladder irritants. Often giving in to the urge to void too frequently can just exacerbate the problems. There's a lot of lifestyle modifications we can do with the urgency incontinence as well.
I love that you have a comprehensive approach and it's not one size fits all. It's very much about what's right for the individual. And so I'm excited that we have a resource in you and at the Christ Hospital for people to be able to make a change and know that you have the resources in this region to be able to invest in yourself in that way. So thank you so much for being here with us today. We really appreciate it. If you have any more questions, feel free to reach out directly to Dr. Shah. All of her information can be found on shop.wisewellnessskill.com. And you can type in, Dr. Shah, and you'll be able to figure it out. So thank you so much for joining us here. Have a great day.
Thanks a lot.
You've been listening to Well Within 10, a bite-sized approach to working on your wellness. You can find more episodes wherever you get your podcasts.